So let me get to some emails here. This is Pete, 35. I do social work therapy specifically around substance abuse because of, he says, you're part of the reason for that. So I'm going to pick your brain about getting a therapist. Since I'm educated in therapy and evidence-based practices, whenever I talk to a therapist for myself, I completely withdraw when I hear and feel the clinical talk. It makes me feel like a client. You are a client when you go in as a patient. You are a patient. And it's your job to go along with the techniques that the professional, turn yourself over to the professional. I'm very self-aware. Oh, hang on a second. Let's see. I know more than I start to feel like I know more than them, and oftentimes the work we do and talk about things I've already identified in myself. I feel I'm very aware and just lack motivation to make changes I need, which already tells you that things are not right. Can therapy just not be for some people? Yes. Some people are not good candidates for therapy. There is such a thing. Now, that doesn't sound like you, my friend. So you sound like you would be a candidate for therapy, but what I want you to do is read about resistance. Resistance. You are resistant in a way that you don't realize. You're using your training as a way of rationalizing, which is not what therapy is. As you know, it should be connected experience, and you don't sound super connected, and you got to get that connection going with your primary feeling state so you can be more effective to your patients. He says, I've seen so many and never felt that breakthrough moment or motivation continue. Yeah, that the lack of motivation is part of the resistance, right? Right when the people that have a lot of resistance, right when you're about to break through, that's exactly when you decide to leave. So there you go. So good for you, my friend, for becoming a social worker. But if you're going to help people in a therapeutic setting, you've got to clear up your own stuff. And and by the way, it sounds like that's not the right therapist for you. You have to find somebody that you trust and feel open with and who's really attuned to you. You need the kind of thing I was talking about with our anxious caller a minute ago, which is this sort of emotionally attuned psychotherapeutics. Wife and I have been together
Real quick, what makes someone not a good candidate for therapy?
Personality disorders of certain types.
Oh, okay.
They don't really change, and they stay in these very rigid structures. Schizophrenics don't really respond to therapy, but they do respond to cognitive behavioral therapies. You can help them identify their delusions and things like that. But in terms of, sort of traditional psychotherapy, the person's got to have insight, be motivated, and the defense structures need to be reasonably workable. Now, what happens in my world is, people theorize that things like narcissistic personality disorder are not treatable. I see people get better in recovery. Now, we don't know what can't be really carefully too easily teased out is whether the narcissistic functioning is part of the addiction and that just goes away when you get the addiction handled, or is this person truly a narcissist? I think it's both. And narcissists are not supposed to be treatable, but when their life depends upon it, as it often does in addiction, they become motivated. So if it's a life or death thing, I have seen certain personality styles. Now, obviously, it's not malignant, severe, overblown stuff because they'll always turn that on everybody else. Those kinds of personality disorders, borderline disorders, also not thought to be treatable, but they do respond to something called dialectical behavioral therapy. So the borderline stuff doesn't go away, but it becomes less symptomatic, less stuff associated with it. So it depends what you're doing, and if you are having, OCD, like severe OCD, exposure therapy works for that. And not everybody is willing to do it. They kind of run away from it sometimes. So again, who's a good candidate, who isn't? It's kind of the case that anyone that will do the work will benefit. It's just getting people to really do it. And this guy's a great example. I mean, he's sort of, look what he says. He goes, my ego, he calls it, tells me that I know more than them. So what? Knowing things is not about doing therapy, okay? The work we do and talk about things I've already identified in myself, either A, that's bullshit, or B, bad therapist, so get somebody new, fine. Let's see. I feel I'm very self-aware. Sorry, buddy, that is not the case. You are a rationalizer. You rationalize everything, and you are disconnected from your primary affects, which is where your stuff lies, where your problems lie. And can therapy not be for some people? Blah blah blah. Okay. Anyway.
Follow-up question.
Yeah.
How do you know if your therapist is the right therapist for you? Because it seems like, you might have to go through a few of them to find the right fit, and like maybe one type of person doesn't work for you when it might work for another person.
Yes, that's absolutely true. So what's your question exactly?
How do you know if you're onto like the right
So
path?
it's hard. I'm a big fan of taking referrals from professionals, mental health professionals that you know to be good and effective. That they tend to congregate together. You know what I mean? Good people tend to identify and see good people, particularly with therapists. It ain't as easy. The one sort of caveat I give people is you may feel good sometimes, but generally speaking, you should not like it. You should not like it. It should be challenging. It should be uncomfortable. You should be spitting out afterwards a little bit as you process stuff. And these days, the other thing, I mean, trauma is so much a part of everything for everybody that you really need to look for therapists that have trauma training, EMDR, that kind of thing. And the further up the food chain you get, the more likely you are to, there's a reason that we have higher levels of training. It's be able to deal with more difficult things, but also to protect the public. So PhD, MD, and I will tell you, LCSWs, in my experience, tend to make excellent therapists. I don't know why. I don't know what it is about that training, or I think it's more about the kind of people that go into that kind of training for therapy. They tend to be very empathic, very good and sort of emotionally focused type stuff.
Does it matter if you don't share the same maybe like life perspective or values with your therapist? For example, like mine's pretty good, but one time she recommended that I watch Gwyneth Paltrow's Goop, and now I don't know if I can trust anything she says anymore. Like, does any of that matter?
Well, did you try watching it?
So
I tried watching it before she recommended it.
So I call that an opportunity. So what will tell you whether this is going to work or not, this relationship, is you have to go do it, watch a little bit of it, and then bring back to the room how much you hated it or whatever you're experiencing.
Okay.
That's
I can do that.
Yeah. That is the challenge of therapy, is being completely open and bringing all of it back in. And if she or he says something you don't like, bringing that in, letting it all hang out. I mean, everything you're ashamed of and guilty about, that needs to come out in the room.
I'm bad at that.
Yeah. So, yeah. And so the more you do, the more open you are, the more you're able to do it. And, people kind of have this weird thing where they need to be liked by their therapist and need to be seen as, a good person. And you may have things you did you're not too happy about. Trust me, they've heard it all.
I was kind of like that too. Like I remember when I was, because I had always dealt with some sort of anxiety, like just at a normal base level. And I was like, oh, I should really talk to someone about this, because like I'd find myself just kind of pacing in my apartment, just repeating conversations and stuff. And it would take me like somewhere between 10 and 20, 30 minutes to realize that I was doing it.
Uh-oh.
And so I'd be like, oh, I need to take care of this. And the first therapist that I had encountered was just someone that was just kind of like, oh, that's crazy. That's like, I feel like they were kind of early in their career and weren't great at it. And in my mind, I was like, therapy sucks. I'm never doing this again. Well, but then eventually I found the right one. And I was like, this is the best decision I've ever made.
Right. The one that lets you keep smoking tons of weed. That's the one you're going to stay with.
Yeah. In some way, you kind of
That's not an issue, Drew. Why are you bringing...
See? Just saying. What's that, Chad?
Yeah, you do want someone...
I'm just saying, if you have anxiety and your therapist doesn't address substances that you're taking, alcohol, whatever substances, one of the key sort of fuel behind anxiety is substances of all types. And if you're there to get anxiety treated and they don't bring that up, I got questions. That's all I'm saying.
No,
you
totally,
can choose not to follow what they tell you, but that
I followed everything that they told.
I know, but the fact that it didn't come up.
I think it did. I talked about that I smoke a lot of weed. I'm like, is that an issue? He goes, does it stress you out, or does it help you like dealing with stress? Like,
oh no, he doesn't. He doesn't really understand what.
All right,
this
yeah,
is not
sure. Just
MD.
the best decision I ever made in my life. Drew says it's a piece of shit. That's fine.
No, I'm not saying that. He might be a good therapist, but this is always the problem: is the medical stuff doesn't get addressed. I mean, it happened to my own family members.
But now I'm stressed less. I'm not as stressed.
All right, my daughter's talking about her stuff very publicly, so I can talk about it. She's 18 months sober now, and she had hyperemesis, and she had, like mania and all kinds of shit, and no one ever addressed the cause for 6 months until she bottomed out, and then now she's completely normal off all meds, no more vomiting, everything. And it's like, that makes me angry when doctors don't don't continue to think about what's going on. Don't think more carefully. Anyway,
I kind of want to go back to something you were saying to Nadav earlier when he was talking about smoking weed. And in terms of like,
Yeah, Chad. What? Yeah.
yeah, because like in some ways you want a therapist to challenge you.
yeah,
Right.
not in some ways.
In
Always.
Okay. Yeah. So yeah, how do you avoid getting comfortable with someone just reinforcing your bad behavior versus embracing?
That's
change?
my point. It should be really uncomfortable. Now there's an intermediate zone here, which is getting people to be ready to change. Right? So there's one excuse for your therapist being the way he or she is, which is I'm trying to increase his level of self-awareness to where he gets motivated and looks at some of these other things that he seems unable to look at right now. That's a reasonable position to take. You got to meet people where they are. But what really bothers me, Chad, is when people, the professionals, don't bring it up with clarity. Like they need to bring it up and go, hey, you're here for anxiety. That is making more anxiety. I'll work with you, but it's gonna be really difficult to get this under control with that going on.
I recently ran into an old friend who was telling me they got into therapy, and it sounded like she had just been like kind of just being reinforced in her assumptions that she was a victim of stuff, but really she just kind of sucks sometimes. So I think it's in some ways bad for people to be reinforced that way.
Listen, so she probably, that kind of person usually tells you how much they love their therapist, right?
Yeah.
Not good. You should not love your therapist. Your therapist should be, she's going to challenge me. She's going to see through me. It should have a certain amount of,
I dread seeing mine.
Dread, anxiety, that kind of stuff. Yes, that's good. Just keep going. That's when you want to keep going, when you don't want to go. If you're going to therapist and she makes me feel great, why are you going? Go to the gym instead. You feel great from that too.
But what if you feel good about making progress? Where you're like, oh, I was given tools today on dealing with the things that I have trouble with.
I told you, I said that's a viable thing. Okay. I have no problem. What I'm taking issue with is them not being clear and bringing up like, if you really want to deal with your anxiety, we're going to have to deal with that. In the meantime, I'll work with you. That is fine with me. I have no problem with that. But I have seen so much where they don't do that. And look, I'm a big fan of really deeper kinds of experiences in the therapeutic setting, and that requires that the therapist clear their shit up and that they study a lot of different kinds of techniques and work for years developing them. So it's not that. That's why the letters after the name start to be ways you can kind of reduce the risk of having somebody that's not challenging and not going to really help you out. But even then, there's plenty of problems.
You mean like MD or
MD, PhD, PsyD, LCSW? Those are the letters that you want to look for. And like I said, I like LCSWs. I like PsyDs. I've hired a bunch of them. My own therapist was an LCSW. I've been very impressed with what their training has been. And so it doesn't have to be an MD. In fact, MDs often are not good.
How about LMFTs?
LCSW.
Yeah.
It's no LMFT can. I have one colleague of mine who's an LMFT who became also a psychoanalyst, and she was exceptionally good. So it's possible, but they have to work at their stuff.